One of the things I'm asked about most in my clinical practice, as well as from all of you, my amazing social media pals, is how does trauma show up in relationship to all those labels? What do they mean? Acute stress disorder, post-traumatic stress disorder, complex PTSD. And what about those of us who experience traumatic experiences but don't have PTSD? I know I didn't develop PTSD until I was 29 years old, but man, did I have a whole host and variety of different traumatic experiences that definitely impacted my mind and body until that trauma and PTSD started. And I know I'm not alone in this experience. So in this video, let's unpack all things trauma. Let's get into these labels and how these things unfold neurobiologically, which is really what this entire series is about. So we're going to use an analogy of a beach and walking on a beach and or living on a beach. So let's imagine that we're out for a beautiful sunny walk on a beach and we cut our foot. It has happened, it is there, and it's pretty deep. And it takes about a month for that wound to heal. And during that 1 month healing period, you notice that it's really hard to walk. It's hard to experience your life as you normally would. That is akin to acute stress disorder. You've had a traumatic experience and your mind and your body are experiencing the symptoms of that traumatic experience. And they might show up with insomnia, hypervigilance, increased irritability, the whole host of PTSD experiences. But within a month, they go away. It's healed. You're good. But then what happens if you're walking on the beach and you, same thing, cut your foot? And that cut gets infected. And you start to have a whole host of mind-body experiences. The infection goes up your leg, and then you're worrying about, wow, do I even get to keep my leg? Or you notice that your brains can't stop thinking about the cut that happened. Or every time you move while you're sleeping, you get disrupted and you start having bad dreams about that cut on your foot. Well, now you have PTSD. And what happens if you're living on a beach or you get stuck on a beach and you can't leave? And there's tsunamis and monsoons on that beach all the time. And it's constantly raining and it's a rocky, scary beach. And by the way, you don't know how to swim. You don't have the skills or the tools that you need to survive on that beach. That's complex PTSD. And that will exist across the course of your life unless you learn the skills and tools to come get off that beach, which is possible because our brain can heal and recover from complex PTSD. It's very cool. But what happens in those experiences where we cut our foot? It heals, but then later our foot starts hurting 6 months, 8 months, 10 months, 12 months later. Maybe we cut our foot and then 12 months later we're running a marathon and we go, wow, my foot's really hurting. And you notice that that cut, there was a mark there that was left and it starts to get inflamed and cause problems and get in your way. And all of a sudden you can't really walk as well as you used to. You're hobbling along, maybe waddling a little bit. You're reaching out to your doctors. You're not sure what's happening. You don't really remember the experience on the beach, but your life and your mind and your body are being really, really impacted. And then something happens. You're out for a run and you stumble and you take a pretty hard fall. And then all you can think about is that day on the beach when you cut your foot. That's PTSD with delayed onset. Your mind and your body are going, I remember that thing that happened all the way back there, even though it's something here and now that triggered your brain and your body to go back there. Or it stays inflamed. It's fine, it's not infected, but that scar just seems to cause ongoing difficulties in your life. And you don't really understand why, because you're not thinking about that day on the beach. You just know you're not living the life that you want to be living. There's something going on and your foot's constantly getting in the way because it's inflamed and it hurts. Some days you're okay. The next day you're limping. Some days you're like, gosh, I don't even think I can get out of bed at all. I don't think I can go to that social event. What if I can't put on my shoes? Or what if my shoes really start to hurt? Well, that's anxiety or depression. that is caused because you had that experience on the beach where you cut your foot. That's part of what happens when our brain experiences a stressful enough or traumatic enough experience that it shifts neurobiologically, but doesn't result in the symptom onset of PTSD. Those encoded experiences can still show up in a variety of ways, in a large variety of ways, and cause ongoing stress or harm to the way we're trying to live our lives. Peri-trauma is what that is. Those are those encoded experiences. So trauma can show up in so many ways and have such large and yet different impacts on our lives. And did you know that individuals who experience recurrent depression usually have 6 or more traumatically encoded experiences? 6. Begs the question, is recurrent depression about trauma, or is it a mood disorder as they talk about it in the DSM, Diagnostic and Statistical Manual? It's an important question. Trauma is diffuse, and of course, we have the opportunity for healing in our hands. But it's not just about our thoughts and our emotions. It's about the entire mind-body system. And it's about intentionally leaning in with curiosity to understand, when did our mind and body experience something? Or in the case of complex trauma, not experience what it should have: safety, security, lovability, and the teaching of tools to be successful in our world. Those nuances are important because they set us up for, first and foremost, self-compassion. We go, oh, that's why my brain's doing the thing. And second, they play a critical role in guiding our healing journey.